Well, I was in research actually before I went into medicine. I was in graduate school doing research, and my interest was basically in trying to combine a medical career with a research career. I thought pathology was an ideal field to do that, and I think it has been. I think it's turned out quite well. Well, aside from the ability to do research, it's the interactions. I think pathology is basically the one field where you can interact with basic scientists. On the one hand, you can interact with clinicians on the other hand. You can work across those boundaries and talk to both groups and bring ideas back and forth between them. The discipline basically sits at that junction between clinical science and basic scientists. And that's really what I've found most rewarding about the field. Well, of course, interest in pathology is certainly would be at the top of the list, and part of that is, I think, a interest in visual things. Much of pathology involves looking at slides and making interpretations. That's something that's not measured very well in the first 2 years of medical school. If somebody's done a rotation in pathology and has some feel for how much they like that, that's important. I think a very strong background in basic science is very important because pathology is so basic science oriented. And another thing we look for, at least in our program, is interest in teaching, because our residents in our department has a very heavy teaching load. And that's actually something that's true in general in pathology. Not everybody, in fact a minority of people end up teaching in a university, but pathologists are always involved in tumor boards and conferences, interdisciplinary conferences, and that's basically teaching, and the ability to sit there and make a presentation and give your interpretation and get your ideas across. It's an important part of the field. Well, I think that's one of the benefits of pathology. I don't really think pathologists work any less than people in many other specialties do, but we have a unique ability to schedule our time, which is often difficult to do in other specialties that are driven by immediate patient concerns. So we're able to put our work into most of the time into a scheduled flow. We're able to get that done and very efficiently, and it makes for a reasonable amount of off time to devote to your personal life. Well, I think one of the biggest challenges to pathologists in general is establishing their relevance. Pathology attracts a certain number of people who are quite introverted and would be quite happy if they could sit behind a locked door and write a report and kind of slide it under the door. But that, when you act like that kind of black box, you're not seen as a colleague, you're not seen as a member of the team, and you're not seen as essential. And I think it's absolutely critical that pathologists interact with their colleagues, interact with people on the wards, that they flesh out their recommendations and are seen as a consultant, which we can do par excellence when people do it. And when it's done right, pathologists are seen as absolutely critical to the medical mission, absolutely critical to patient care. And this is what will make the difference in the future between pathology as a field being something that's absolutely at the center and essential to modern healthcare, or on the other hand, being something that's outsourced to Southeast Asia. Well, a lot of students have an image of pathologists as somebody that spent all their time locked in the basement and never interact with anyone. And not only does that not have to be the truth, but in fact that is far from the truth. I think pathologists do much more interaction with colleagues, with people across a broad variety of specialties and this is very rewarding. I mean, in my career, I have interacted with specialists in absolutely every specialty, every field, every organ system. I don't think anybody else does that. I've even had long-term collaborations with psychiatrists working on post-mortem studies of schizophrenia, traumatic brain injury, and things like that. There's no other specialty where you have that breadth of interaction with your colleagues.